Okay, good evening, Stuttgart Military Community. My name is Colonel Jason Condrey, Garrison Commander, and first of all, I want to say thanks for being here tonight, for tuning in, for the questions you will ask, and thanks to many of you that already put some questions in. First of all, we've also got lots of people participating virtually that are much more knowledgeable in answering some of the questions that you have, and hopefully they will answer, especially should I come up short in some of my responses. I want to begin tonight with a brief update, on our efforts as a community to prevent the spread of COVID. I've also tried to capture a lot of the questions that you asked in advance and answer those up front, and then I'll go into some of the questions that the team here will ask me on your behalf. And so I guess first it's important to say that the efforts of this community have resulted in a noticeable reduction in the number of COVID cases. And so I think it's important to recognize the fact that our actions to fight the spread, of the virus, of an invisible adversary's efforts, have been focused on three different kinds of people: people that have symptoms, people that have yet to develop symptoms, and people that would never develop symptoms, yet still we're spreading the virus. And so I'm going to highlight each of those three groups and talk about what we've done and how that's affected our ability to find the virus and stop its spread. And so for the symptomatic people, those people that, that recognize that what they're feeling is not normal, go see a doctor, go get tested, go get screened. The main areas that we've been looking for them and finding them is at our ACPs and at our screening sites at the entrances of some of our critical services. A lot of that has been focused on education, and even just this last week, the CDC has updated its guidance as to what are the symptoms that people should be looking for as we continue to learn more about this virus. The other piece has been the testing and the contact tracing. But unfortunately, if someone's already symptomatic, we're behind the virus. The virus has already potentially spread to somebody else. So these are things that we do to rapidly put some boundaries in place to constrain its ability to spread further. Because what we don't want is for somebody that's a positive case to continue to spread. The pre-symptomatic, this one's a little bit more difficult. So when you look at the red, white, and blue concept, the 5-day windows are designed to allow a member of the community that may not be out and about or a member of the workforce to have something that they are not quite sure if it's a symptom develop into a symptom. Also closely linked to that is the rapid COVID screening that we've given to supervisors, we've given to lower level leaders, and it's kind of that, with that sheet and those questions can be the second set of eyes before somebody comes into a workspace, before somebody goes to utilize one of our critical services. And then the last group is our asymptomatic individuals. And we've identified at least 6 that we know of were spreading the virus within our community. Our testing revealed 5 people that never had a symptom and were carrying the virus, were infected. And so those individuals are our biggest challenge because if they never experience a single symptom, they would never know that they were infected, would never know to go get tested, would never find a reason to self-isolate or to be quarantined. And so it's because of those people being out there why we've implemented the physical distancing, the hand washing, the other hygiene, the separation of both the community and the workforce, as you look at the red, white, and blue concept. And then most recently, the cloth face coverings. Yet one more measure in place to help us protect not only ourselves, but others, because we may be carrying the virus from that asymptomatic spread. And so those efforts, the things that we have done, our adherence to red, white, and blue, the other things that we've transitioned from person-to-person contact to virtual or to appointment only, and the measures that we've put in place, both physical and conceptual, allowed this community to go a full 2 weeks, what some would term as a full incubation period of this virus without a positive case. But today that streak ended. And of course, the source of that individual's infection is not clear, nor is the scale of the spread, because that individual was in our service areas, was in our workspaces. And so I think it's important to understand that our efforts thus far, everything that we've done, hasn't killed the virus. The virus is still here. It's still waiting for the smallest misstep. It's waiting for us to do something that allows it to infect, to spread. So it's not a smart enemy. It's not a thinking enemy, but it's present and you can't see it. And so with so many across the community doing what is right, what is needed to protect us from the virus, there are still too many that aren't taking the right precautions, that are taking risks. And it's not just a risk for themselves, it's a risk for everyone they come in contact with. Right now we have 3 service members and 2 civilians whose actions appear to have either violated the general orders detailing the COVID public health measures, they violated medical quarantine directives, and their behavior resulted in the loss of access to services and in at least one case, access to the installation. Those are not the things that we were hoping would come out of this. I know I've personally halted Shirts and Skins basketball games. When I've walked up on a late evening party to see, hey, is this a single family? Is this us doing the right thing? Are we putting ourselves at risk? And so I'll say that if this community is not disciplined and not vigilant, then I don't think there's any amount of measures we can put in place that'll protect us from the virus. And we still don't know enough about it to know how we need to protect those that may be the most vulnerable to it. And so there's got to be a willingness to take actions that keep you, keep your family, keep those around you as safe as possible. I don't have enough MPs, and myself and other leaders across the installation can't drive around constantly and ensure people are doing the right thing. That has to be something the community owns. And sure, when I find it, and when I've got undisputable confirmation that things are wrong, then we will put that through a process and adjudicate it appropriately. But that's not the outcome I'm looking for. So there are many that want easing of measures. And I'll be honest with you, I don't know how to do that and still protect those that need the protection the most. Because those few that are uncaring or unaware of what their actions may have as an impact on others, they're out there. There's not a lot of them, but they're out there. In terms of what's happening outside the wire, most of our community lives off post. So we remain linked very closely with our German partners. And I will tell you, they're very cautious about the things that they have done recently. And they are split as to whether or not they've done too much and whether or not they're willing to deal with the potential costs that moving too fast could have. And so they're trying to figure out how to be very deliberate, very cautious, and do things in a manner that allows them to take a step back if they need to. And so while they have reopened things, they're not going to be quick to reopen activities and businesses where physical distancing, the hygiene measures, and the ability to mitigate some of the close contact can't be implemented. We're talking to them, we're anticipating their changes, and we want to make sure that everything that we do on the installation at a minimum mirrors, if not exceeds, what's happening off the installation. So lots of questions tonight about changes to red, white, and blue and some of the other visible measures we have in place. And so from the very beginning, with each color group in the first and second cycles of red, white, and blue, we were looking at ways to mitigate the inconveniences that delay in shopping, delay in access to the mailroom creates for members of the community. And so starting this red, white, and blue cycle, curbside pickup at the main exchange and at the Robinson Commissary are designed just for those inconveniences, just to address those needs that in the first cycle we didn't necessarily have in place. And the intent is that if you are a high-risk individual, you have a high-risk family member, that you are using those curbside services. If you don't have the ability to go inside the store, then you're using the curbside service. So those are designed to address some of the inconveniences that a lot are focused on as it relates to red, white, and blue. Lots of questions about screeners at the gates and at our high contact services, our critical services. And I know many of you will say, I already know 2 symptoms and know where to go get screened. But I'll tell you that when I ask people what the symptoms are, and when I ask our screeners what the symptoms are, they don't all know the answers to the questions. And so the point is things change. And not everyone is tuned into the recent developments from the CDC and the recent developments that are coming through public health channels. That is our way of getting the word out to the community. That is one way that I can ensure as you come in and out, you're able to find out about changes. And yes, that does depend on the individual that's asking the questions. But that's the intent, is to make sure that as things change, and this is a very dynamic environment, and we're learning more and more about the virus each and every day, that is an opportunity to share that with the community. And by chance, to catch one individual, and maybe it is only one, that would otherwise come in and spread the virus. And if asking those questions causes somebody that might not be thinking about how they're feeling to think about it and redirect and get tested, then it's successful. But I admit there may be a better way to protect and educate. And so having a conversation with leadership across the installation, there may be a better way, and I'm open to it. So as we look to make changes, I promise that I will share those with you. For red, white, and blue, we're looking at ways to evolve that, to make it address the requirements, the things that we need to do to protect ourselves from the virus, but at the same time, give the community back some sense of normalcy, as much as can be achieved right now. So second wave, a lot of headlines, a lot of questions about the second wave. I will tell you that the measures we have implemented right now protect us from the second, the third, whatever number wave. We don't know when it's going to come. We don't know how big it's going to be. But if we've got the measures in place that allowed us to separate in time and space, and we ease some of those measures deliberately so that if there's a spike, we can step back away from that, then we're prepared at all times for a second wave. We don't have to gear up. We're ready. And so again, don't know enough about this virus. I don't know who truly is high risk or what we need to do to protect those individuals that are high risk. And I acknowledge that the probability may be very low. But when the severity level is potentially death, then it's worth the energy, worth the effort, worth the inconvenience. It's worth people doing the right thing for themselves, for their families, for their neighbors, for their coworkers, to make sure that we don't have to look in the mirror and say, was what we did worth that? Quite a few questions about returning to work and testing. So some of our workforce, as they return to work, we are looking at options to do some testing. And sure, there is a chance of a false negative, but I will tell you that if we got a positive and found somebody that was asymptomatic, that would be incredibly important to know before we send somebody back into a confined workspace. So that will happen. Unit leadership across the installation are taking a look at how they will do that. And as they ask for the resources to test those individuals, then the garrison and the clinic will be prepared to support. Local testing has dropped off. There are fewer people coming through the drive-through clinic. We are no longer doing weekend screening, just as our German partners off the installation don't do weekend screening. We opened up a little bit earlier on a Monday. This is starting next Monday, so that if you are scheduled to return to work that day, that you can get cleared by a doc and go back to work, go back and rejoin the community. I will also state that our ability to test locally is expanding. We've received the machinery and are starting to receive the supplies. And so we will have the ability to do our own testing. And that adds to the capacity that we have as we send test samples away down to up to Landstuhl Hospital. DoDEA. There's lots of questions out there about the school year, how we might evolve the virtual learning, questions about graduation. I know I've met with the principal and several others. I know parents are very interested as to how we might do that. And so I still don't have all the answers that you're looking for. I know there's lots of teachers in the audience that may be able to answer things specific to that topic that I'm not prepared for. And what I can tell you is that when there's a decision on schools and how those changes will be implemented, that we will let you know. In terms of returning to school, I still don't have a solution to buses and classrooms that were overcrowded before the first hint of virus came around. And even if we put kids and students in masks and had them wash their hands lots of times each day, I don't know that we could mitigate the spread of the virus in our classrooms, in our school buses. So I'm hopeful that we'll have more information there soon. Okay. I'll now take some of the questions that have rolled in. I'm sure that I was, unable to address some of the specifics that had been submitted. So
yeah, plenty of questions coming in, sir. Christina's asking, will the furniture store be allocated more hours so they can process and put out new pieces? We were told Saturday they have new stuff in the back but don't have enough hours to process it and put it on the floor.
So I know, Christina, right now that our general manager for APHES has been looking hard at the furniture store. As he got more staff back, the first thing he asked was whether or not we could reopen that because we have people that have just moved in that want new furniture. And of course, there's some other things that you can buy at the furniture store. The first weekend we opened, it was busy the entire day. And so I know he's been looking at how you get the staff there to make sure that the things that the community wants and needs from the furniture store are available. In terms of deliveries and some of the specific pieces, hopefully he's online or one of his other associates is online and can find a way to answer some specific questions with some more specificity.
Any plans on being able to reopen the gyms with social distancing and cleaning guidelines? That's from Stephen.
Yeah, Stephen, that's a good question. So first of all, that is one of the areas where we will pace behind our German partners. And so they only for their professional athletes have they opened back up fitness centers, and they are probably not fitness centers, they're training centers and focused on that specific athlete or that team. And so as they look to open up fitness centers and indoor physical fitness centers specifically, then we will figure out how we can implement similar measures and do some of the things that you've seen, whether it's watching news from the States or whatever the case may be. But that still continues to be a high risk event. I'm not confident that we would be able to clean all the equipment between uses, and I'm not confident that everybody will clean it to the standard that you would expect to receive it as you picked it up. So those are some issues that I'm not quite sure how we work through just yet. I think we'll have some more time to think about it, and there may be somebody that comes up with a unique solution that makes opening those up very easy and something that we can do rather rapidly. So I'm hopeful to have more information about that soon, because I know how much our community is looking forward to getting back into the gyms.
Common question that comes up most weeks is we'd like to know about how far we can go out for hikes. All the information I've looked up is giving me different parameters. That's from Angela.
Angela, that's a good question. So, that's a question that the German authorities deal with as well, because as you see, every time you go out into the woods, our German counterparts are everywhere. The limitations that they've placed on travel, and I will. I think official travel, our Department of Defense has been very clear. We're staying within the same country. I think we need to stay within the state of Baden-Württemberg, and there isn't an overnight stay possible. Hotels haven't been opened up back yet for tourism. You can't rent a home on Vacation Rentals by Owner or any of the other sites where you previously could get someplace to stay. And so your day trips need to be focused on getting back home at night, because I don't think there's going to be an option otherwise. And of course, how far you can drive kind of depends on how long you're going to stay at the location. And I know some hikes are rather short. Some are much, much longer. And so, there's going to have to be some individual decision making that goes into that. But the intent is that we're not traveling, we're not spreading the virus, because that is the intent of the local measures, the German measures, and then of course the Department of Defense measures, is to ensure that we are not either contracting the virus as we go somewhere else and bringing it back here, or in the eyes of many other communities looking at Stuttgart, we are not bringing the virus from Stuttgart and taking it somewhere else. So that's the thinking behind it. And in terms of specifics, honestly, it's going to depend.
This next question is from Travis, probably covers several PCS questions that we're receiving. What is the plan for families PCSing after the travel ban is lifted? What is the garrison doing to prepare for post-travel ban PCS shenanigans? Yeah, so Travis, we're spending a lot of time trying to understand, first of all, what the demand is going to be. Understanding how many people are leaving, how many people are coming in, by service, civilian workforce as well. We've got lots of planning that's ongoing. We're working closely with all the units across the installation. Some of the people are exempted from the travel ban, and so I will tell you the processes haven't halted. PCSs are happening right now. People are leaving, some people are arriving. So whether it's an exemption or an exception to policy, those are happening. And we're going to lean forward as much as we can, because we acknowledge that a lot of the things we used to do face to face, as we would take somebody through the completion of their, paperwork to ship their vehicle or to do household good pack out, all of those things, we want to find a different way to do it. And so we're implementing some new measures. I will tell you that the PCS button on the app will be where you find how those things are going to be happening. How many of those things that we used to do in person are now going to be, with a phone call, with some sort of video chat, with watching some sort of prepared video. And so the team that helps me do these kind of things, they're focused on making that content, that smart content that provides you the guided tour through paperwork, that provides you the expert orientation on how to do this process, and ideally answers 90% of the questions that are out there, and then creates the opportunity for those remaining 10% to be asked to somebody, and widens the hours where you have access to somebody that has the answer. So those are the kind of things that we're looking at. We recognize that we're trying to do something that we would stretch over 6 months in a 3-month period, in half the time. And so we've got to be creative as to how we expand, the pipeline. And there are things that aren't within our control. Like I don't know that commercial airlines are going to start, flying out of Stuttgart the same way they were 6 months ago. I don't know how people with pets are going to be able to get reservations for their pets if commercial airlines haven't resumed travel. The Patriot Express, the SecDef's guidance says to maximize the use of contracted and military air as much as possible. And so that may be something that previously, if you were here in Stuttgart, you used the commercial airport as your primary means, and that was an exception. So those are the things those are questions we're asking. Making sure that we can have enough packing crews and enough moving trucks, and that there's ships traveling with vehicles and household goods. I mean, all those things, they have to get back to a sense of, or to a level that supports what we need. And it's not just us, it's the entire theater. So there's lots of efforts ongoing to try and understand what the requirement is, so that we minimize, the amount of time people have to stay here waiting to move on to the next location. This is from Glenn, who's talking about the future when people are coming back to work. What will the considerations be, if any, for high-risk personnel
when they're being called back into work?
Glenn, that's a tough question, because I think if you ask 10 doctors to define high risk, you'll get 10 different answers. And I don't think anybody wants to bring somebody back into work if they're, if that amounts to an unacceptable risk. And so it comes back to understanding what the risk involved is with returning to work for somebody that's high risk, and what measures could be implemented. And so I think we will get more guidance on that, and it will come from the experts, and that will be those are the conditions, in my opinion, that will be set before we start asking people that we've previously said, hey, if you're high risk, stay at home, before we ask them to come back out and come back into the workplace. But I mean, we've got lots of high risk people across the installation that are working today that we've arranged or rearranged the workplace so that the mitigation measures are in place. That's not possible in every job, not possible in every headquarters. But I, as I've observed, that's what leaders and supervisors are doing across the footprint. And so I think more opportunities like that will present themselves as we learn more about this virus and what truly constitutes high risk.
Anne asks, is it possible to place Popeyes and Pizza Hut on different rotation days so there is always a delivery option?
And that's a good question. I didn't know that Popeyes delivered, and so I will ask that question to our general manager to see how we may maximize some of the delivery options. Again, I know I've asked people to stay at home as much as possible, and having takeout come to your door is one of those ways. So good question. We'll see if I can get an answer for you.
And will you consider longer hours for the PX, especially for the clinic personnel and others who don't get off until 4:30?
Yeah, I think that is one way that, in the near term, we may be able to find, evolve the red, white, and blue. We tried to find the right balance between the hours that these services we deemed as critical were open, and of course, having screeners at the front of those, at the entrances to those. And so every one of those individuals that you see outside of all those critical services, you see asking questions at the, at the gates. That's not their day job. And so, the more hours that I ask them to do that, then, there's an opportunity cost as it relates to what they would be doing otherwise. And so there's a fine balance there, but I think there may be a way to expand some of the hours. And so I'm talking with the service providers right now to see how we might be able to do that. And there may be some other ways that red, white, and blue evolves. It was designed with the virus in mind, and if there's a way that it can evolve and still do what it was designed to do, then there's no reason not to let it evolve.
So Ashley has asked a question along those lines. Can we expect red, white, and blue shopping dates throughout May?
I think May you should settle in. Red, white, and blue is here, and this next cycle we found a way for, if you were not able to shop in store, you can still get the things that you need, and we'll continue to look for other ways to mitigate some of the inconveniences that were apparent right out of the gates, and do that in a way that doesn't compromise our ability to protect ourselves from the virus. Like I said, we had almost 2 weeks of no additional cases in this community of 28,000 that we know of, and so that's a pretty a pretty remarkable milestone, and it's because we did things like that. And sure, people will say that it was over the top and can't believe we had to do that, and nobody's doing it anywhere else. I will tell you, the conditions here weren't like anywhere else, and so I am reluctant to throw out the measures that have proven to work for this community, and I would rather, if we're going to make adjustments, do them in a very deliberate manner, and do them in a way so that if we know that something has created a new problem for us, that we can step back away from that and perhaps find a different way.
So we are down to our last couple of questions. The public are jumping on the questions as fast as they're being asked, so it's good for them. Marcelino asks, are baggers going to return to the commissary anytime soon?
So I don't know. Again, that's another set of hands that are touching groceries, that have contact with every person that comes through that register. And so that's an additional risk. And the question becomes, is that an acceptable risk? Do we have the measures in place to ensure that somebody that doesn't have any symptoms, that is asymptomatic, or hasn't developed symptoms yet, but is still infectious, have we found ways to identify that? Not only you as a bagger or the person running the cash register, but also every customer that's coming through there and buying groceries. And so that's why questions like that and changes like that, I think we have to be very, very deliberate about it. Make sure that we've got the right things in place. And it may be as simple as, the wearing of cloth face masks, protects us, or does the bulk of the protection and eliminates the bulk of the threat that the virus has created for us in the past. I don't know yet. Maybe we'll know that soon. Maybe there'll be some more analysis that allows us to make a decision like that and do it with confidence. It's just until there's more confidence and more understanding of the virus, I'm hesitant to do something that puts people at risk. And so I think that's what you expect of me. And the only thing I can offer is that I will tell you why we make a decision when we make a decision to implement a change, and how we believe we've mitigated any risk, or what we have calculated as the risk with some of the changes. So those are the things that I will continue to offer this community. That's a position we started from. There's nothing that we're doing that's a secret. And so as things change, we'll do our best to keep letting you know. I know, the public affairs team, the community relations team, the community engagement team, they've been out. And so over the next week or so, you'll start seeing a lot of the work that they've been doing, some of the photographs, because we've asked people to stay home. So you haven't been out to see a lot of the things that are happening across the community. You get to hear some of the stories of individuals that have been impacted by COVID, and understand exactly, what this, in many cases, how this community has risen to the occasion. I think that's probably, from my vantage point, have the opportunity to see that more often than not. Sure, I see some of the ugliness where people have not risen to the occasion, but that's the thing that has had the most most impact on me as I have a chance to go around the community. I do want to let the community know that there's a phishing scam out there that uses our health clinic as clickbait. So keep your antivirus updated. Navigate suspiciously if it looks too good to be true. It probably is. Verify the authenticity of the sender. I know that as I got the notice from the clinic commander and it said, phishing, I called her to see if the email she sent me was safe to open. So that's the kind of things that you need to be aware of in this day and age. There's lots of people that see this virus as an opportunity to take advantage of someone, and I want us to do as much as possible to mitigate against those kind of threats. I do also want to highlight that there are members of our community that for medical reasons are not able to wear masks. I know our children don't wear masks if you're under the age of 2 or younger, and if you're off the installation, if you're under the age of 6, they're not going to be wearing masks. And so understand that is a reality for some members of our community. I think that wearing the mask is a good way forward, but if the cure is more dangerous than the problem you're trying to prevent, then you can't do it. So constantly caused me to remind the community it's better to be kind than right. And the hard part about putting that out is I realize that there are many within our community that'll take that inch and make it into a mile. And so I need your help in addressing that. You got to keep yourselves honest, and in some cases, you got to keep your neighbors honest. And there's a right way to do that. There's an artful way to do that. And then there's a way that gets the MPs involved. And so we've got a more mature community. We've got a more understanding community. We live close to each other. We live on top of each other. You got to find the right way to do that. But I need everybody's assistance in keeping this community ahead of the virus. Fighting complacency, fighting an adversary that takes advantage of the smallest misstep. It's invisible, but still fighting on our terms. So I appreciate you joining me tonight. I appreciate the great questions. I look forward to more questions. And you know, it's COVID day until it's not. Stay vigilant, stay healthy. Have a great night.